will go to the Kotoka International Airport. It does appear that something that happened there under government, the people in government don't seem to know about it, or at least they have not seen the contract regarding the controversial $150 per antigen test that was being conducted. It was a major issue during the vetting. The Minister of Health designate, former Minister of Health, was asked about it. He said he had no idea. He hasn't seen it before. And Ghanaians got livid. We had the Foreign Affairs Minister appearing. She was asked. She said she hasn't seen it, hasn't seen the contract. But all she's aware is that there has been a decision by the sub-regional body for the test not to cost beyond $50. Then the Deputy Attorney General, former, now Attorney General designate, Godfred Dame Yeboah, appeared before them 6 solid hours of vetting. He said he also hasn't seen it. So who shall we ask about it? We shall be telling you why the questions are being raised about that particular contract. There's a suspicion, and it goes to a very difficult situation. Then we are talking about the vaccines that are expected, how we're going to manage it. We have experts who are going to assist us with that. We will go to the Supreme Court. The Supreme Court's ruling that refused the objection, so to speak, that Chachuchi Kata raised to the respondents in the matter, closing their case and therefore not intending to call witnesses or adduce evidence. They said that the court cannot compel the EC chairperson to mount the witness box and adduce evidence. We'll get into the details of that. There are some academics, some lawyers, a law professor. We have CSO leaders who have come very heavy on the court in a very constructive manner. But what they say boils down to the fact that, as far as they can see, the Supreme Court has lost a very fine opportunity to have made an exception in this particular case. And that what it did was unjust, is grave injustice in the matter. Right, then we will answer the question today. Last week we couldn't get to that because of the Muntaka matter that came up in the course of the program, whether or not the president violated the Constitution in the appointment of members to the Council of State. So, start off, Dr. Mercy AHUN, immunization expert and former managing director of country programs, Global Vaccine Alliance, Gavi, based in Geneva, Switzerland, joins us to help us with this very important education. Thank you very much for making the time to join us, Doc. Okay, so I couldn't hear you. We need to be sure that we can hear you clearly.
Yeah, can you hear me now?
Great, I can hear you in very clear sound quality. Also joining is Dr. Franklin Esiedu Bequing, Director, Public Health at the Ghana Health Services. Dr. Yao BEDIAKO, Research Fellow, West African Center for Cell Biology of Infectious Pathogens, University of Ghana. And Dr. Soji Tete, Public Health Physician and Council Chair, Center for Social Justice and a think tank based here in Accra. Thank you all, gentlemen, for making the time to join us.
Thank you.
Great.
Thank you.
Thank you for inviting us.
Great. All right. So we are grateful to you. You have dedicated your time over the period to give us the needed education so we can all protect ourselves and to try and stay away from catching COVID, or even if we did, we had a way around it in a manner that we will not be too badly affected. So let me begin with Dr. AHUN. You led Ghana's immunization program, and you were also managing director of Gavi country programs until recently. What is the role of vaccines in the fight against COVID-19?
Thank you very much. Vaccines are biological products which work by training and preparing the body to fight its natural defenses. And so far, they have been one of the most successful public health programs, vaccines and vaccination programs in public health. It is estimated worldwide that about 3 million deaths are prevented every year from the use of vaccines. And currently, Ghana and other countries, we are in the midst of this pandemic. And we know that vaccines are key to ensure that we arrest the progress of this disease in all countries. And we need to work in a collaborative fashion to make sure that this happens. So what COVAX is a collaboration, and it's led by WHO, by Gavi, and the Center for Epidemic Preparation and Innovations, to ensure that vaccines are developed quickly, produced, and shared in an equitable manner in all countries. And Ghana is one of the 92 lower and middle income countries which is going to be a beneficiary of COVAX. Thank you.
Right. So you have had such, a long experience in dealing with vaccines and immunization, and particularly helping Ghana. What are some of the things that Ghana must do to prepare to roll out the vaccines? Let's look at what the challenges could be. Have you seen, for example, a rollout plan?
Yeah. So as I mentioned earlier, Ghana is one of the beneficiaries, and Ghana is going to get the first 20% target population of vaccines free. In addition to that, I believe the private sector is also making efforts, the private sector in Ghana, to contribute to secure vaccines. We also have the AU, which has secured about 270 million doses for the 55 African countries. And I'm aware that government is also negotiating bilaterally. And Dr. AHUN will speak more to that to ensure that Ghana is able to get the vaccines that we need for our target population, because we are working towards a target of 70%, which will ensure herd immunity. And have I seen a plan? Yes. And Dr. AHUN will speak more to that. But there is a detailed plan that Ghana has prepared to ensure that we reach the target population. And this goes to different segments of the population based on risk. The first target is health workers, and then people above 60 years, those with comorbidities like diabetes and hypertension, which make them high risk, those in essential services, security services. So it's a systematic way to ensure that we reach the whole target population. And yes, I've been in charge of the immunization program, but we are conscious of the fact that this is very different from anything that we have done in the past.
Exactly.
This is a totally new target population. And so it's very important that although Ghana has done very well in the immunization program, we have reached above 90%, we need to adopt a business unusual approach to make sure that we reach everybody. So we are going to target fixed points in health facilities, in the community. We are also going to make sure that outreach, mobile, camping out, and different strategies are going to be used to address the target population. So that's the first challenge that we are going to face, that this is a completely different target population. The second is the fact that there have been so many negative stories about COVID.
Right. I will return to you shortly to talk about vaccine hesitancy, people being afraid to take the vaccine, and what you can do to at least remove the mistrust to not hurt this fight. But Dr. Bakwe, as she kept saying, what's the plan? There are people who are asking questions about storage because, as she said, we know this is a special situation and it's not like any ordinary, vaccination program or vaccine. So can we talk about the plan of deployment and issues of storage?
Yes, thank you very much, and good morning to your listeners and viewers, and then other panelists. Let me say that Ghana's approach to vaccines is on two levels. So we are looking at the procurement of the vaccines and then the deployment itself. So in talking about the procurement, that's where Dr. AHUN talked about facilities like the COVAX. The idea is that if you're able to get the vaccines, you need to deploy them. But from the president's directive, we are hoping to vaccinate 20 million Ghanaians. That will give us a coverage of over 66%, which is close to the herd immunity. So that is the direction for the government. And there are several segmented populations that have been targeted. So relying on our system, we have what we call the National Immunization Technical Advisory Group. It's a NITAG. So it's a technical group that actually advises the minister and further on to, let's say, the president on the selection of vaccines. So that group actually recommended that the vaccine that we will need is one, must be safe, must be efficacious, and then somehow it must fit into our existing cold chain infrastructure. And our existing cold chain infrastructure is built in the temperature range of 2 to 8 degrees Celsius. But if you look at the current available vaccines, there are others that can be stored in -20 and -70, which is outside our current storage infrastructure. So in that premise, then in that case, our first choice is the vaccine that fits directly into our existing cold chain infrastructure. But then there are also discussions with other multilaterals and bilaterals about ensuring that at least certain portions of the population will get the other vaccines that will need to rely on the -20 and -70. So looking at our deployment plan, the chunk of the cost is one on cold chain and waste management, and then on delivery and training. So we are factored in all of those things in our plan. And if you look at our current expectation, we are hoping to have a vaccine that immediately fits into our existing cold chain infrastructure, so can easily roll it on. And then we have, let me say that I think, as was said by Dr. AHUN, she used to be the EPI manager, and Ghana has a very vibrant EPI program. Just last November, in the midst of COVID, we were able to do a nationwide measles campaign that covered 83 districts. We covered 6 million people. So we have a setup which exists, and then they are the health workers. So for this particular COVID vaccination, we are looking at over 12,000 vaccinators, we are looking at over 40,000 volunteers, we are looking at over 2,000 supervisors, all scattered across the country. And then we are using the various approaches. We are looking at the face post, using the clinics, the hospitals. We are looking at the camp out. So there's a whole strategy that we put in place. Let me say that yesterday, we had a meeting with DMA, we had a meeting with the Ghana Registered Nurses and Midwife Association to make sure that we have a clear buy-in into the plan so that they make their input. So there's a clear plan, and hopefully we shall achieve what we want to achieve. Thank you.
So let me now get to Dr. BEDIAKO and Dr. Soji Tete. Starting with Dr. BEDIAKO, the assurance that we are getting very sound, and it gives someone the peace of mind that we already have a system, we are just going to plug into it once the vaccines are here. Where we have any, lack, we are working to ensure that we don't have any problems, vaccines don't come and don't get bad, and people don't get wrong vaccines in their bodies. From where you sit, how do you take the assurance from particularly the Ghana Health Service?
Okay, thank you, Thompson. From where I sit, it's great to hear that there is a plan, and hearing Dr. AHUN and Dr. Sedu-Bequin, it's nice to finally get a few more details. There's been talk of a plan over and over, and it's just like we have a plan. But those of us who are not privy to some of these conversations is a little bit concerning. So it's nice to hear a little bit more detail. So I appreciate that. I'm sure the viewers appreciate it as well. But I really like something that Dr. AHUN said, which I haven't heard necessarily from, at least when I listened to the Minister of Health doing his vetting. Simply saying we have great infrastructure. Our infrastructure is based around childhood immunization. I think that's what Dr. AHUN was referring to, that we are very good at vaccinations in this country, but typically we are focusing on infants, soon after birth. That is who you typically immunize. But as she said, this is business unusual. Now you are targeting, a large proportion of the adult population, people who are working, some of whom are hard to find because they are in the informal sector. So there are going to be new challenges. So it is all the more reason why we need a plan. And it's great to hear that it is not, from what I'm hearing from what Dr. Sedu-Bequin was saying, it's not entirely the typical structure that we use, talking about using campouts and other sort of ways to reach people, as opposed to just purely depending on the clinics and places that you typically would find immunization programs. So I think it's really a great plan is great, but it's really going to come down to the implementation, as with everything. And I think, I am sure that people are beginning to think through how many people you will need. Dr. Sedu-Bequin was talking about the number of volunteers and others who are going to be conscripted to roll this out. We can only hope that this plan will be will be implemented as designed. Of course, you have to remember that other health activities have to continue at the same time. You cannot neglect the things that you are doing just to vaccinate people against COVID. So the health system is going to need added resources beyond what is typically used for vaccination. And it would be great to hear that sort of clearly, articulated when we are discussing a plan, because you cannot just rely on the existing infrastructure, because you're going to have to deploy people in a much more aggressive and a much faster rate than you would typically do. Every year you probably vaccinate maybe a couple million. Dr. AHUN probably has the exact numbers, but you probably vaccinate a few million children at the most, maybe even not that many. Now you are looking at vaccinating at least 20 million people. As an immunologist, somebody who is studying the virus, we all understand how quickly we need to deploy, because the virus is constantly changing. If we are too slow, the virus will change, and we'll have to try to figure out how to do this all over again. So I think for me, it's great to have finally a bit more detail, and it's great to hear that multiple approaches are being considered. I think the next step will be hearing the resources that perhaps are being allocated to ensure that this plan will actually be implemented. And then finally, a small point I have is, I have a little bit of a question about the 20 million target, because that is 66%, as Dr. Sedu-Bequin said. All the science points to the fact that the herd immunity threshold is 70 to 75%. So the question I have is, why are we targeting below that threshold? Are there certain considerations being taken? Perhaps that clarification can be made. But as a scientist, looking purely at the numbers, and given the fact that the variant that we are seeing predominantly in Ghana now, which is the one first identified in the UK, is much more transmissible. So it's almost nudging the herd immunity threshold even higher. And so I feel like we may need to start thinking of a higher number than the 20 million, more like 25 million perhaps. But of course, that has economic and other considerations. But that is something that I would like, perhaps to have a bit more clarity on why we are choosing 66 when the science and everybody says 75.
Right. So let me get Dr. Asiedu-Bequin to give us a quick reaction to that. So, Dr. Asiedu-Bequin, very, very, very important issues. You definitely, like he said, this is business unusual, confirming what Dr. AHUN said. So you need added resources, people to do the vaccination. You must do it very quickly to be able to be successful with the herd immunity that we are working at. You said herd immunity 66%. He's saying herd immunity, you need at least 70%.
Okay, thank you very much. And let me put some clarity into what I said. You see, if you look at the population of Ghana, it's about 30 million, and we are going to vaccinate 20 million. So that pushes that this is 66. But the current vaccines that have been developed, it is not for use below people 16 years and pregnant women. So in reality, we are targeting the whole population. So, currently now, nobody vaccinates people under 16 years. So if you look at it, Ghana's approach is really looking at the whole of the available population that can be vaccinated. Let me say that the president's direction is that he wants every Ghanaian to be vaccinated. But currently, the challenge is that the available vaccines are not for use in people under 16 and pregnant women. That's why we are looking at that figure. But in total sense, it's about all the available population to be vaccinated. And I think that looking at our plan, we are, and as was said by Dr. AHUN, there are several strategies that we are using. Looking at the fact that we are looking at adults who have different approaches to life. So that's why we are using the various camp out, the clinics, the static, all those things are being factored in. But I think that clearly we are looking at the fact that if there are new vaccines that come that says that children under 15 can be vaccinated, we'll go for it. But for now, the available vaccines are saying that children under 16 and pregnant women are exempted. But we are going to of that population.
I see. But the question of added resources, the question of children really, at the Kofi Anokye Teaching Hospital, we heard of news about as many as about 9 kids, were infected with the virus. So what should happen to them, especially when we are working at herd immunity?
So you see, we try to look at the data from March to December, and then we try to look at it from January to February. There's very little difference in terms of the number of children affected. If you look at the Kofi Anokye story, what they said was that they had detected 200 positives, and 11 of them were children, which is like 5%. It's not very atypical. So clearly, the infection or the disease is not very common, particularly under 5 or we under 15. I mean that's why the premise is the studies focus mainly on people above 16. And let me say that in terms of the resources, the president has a very big direction for COVID-19 because of its effect on the country. So the resources are central government, partners, and there are multilateral, there are bilateral resources. Yesterday we had a meeting with IMF about how to fill in the gaps. The private sector in Ghana is on board. So I don't think an issue of resources should be a challenge in our drive to get Ghanaians vaccinated.
So specifically, how are you engaging more personnel? Are you looking, say, at NABCO or something? People, how much training is required for anybody who can administer the vaccine?
So typically, the vaccines, they're common. The ones that are available are injectables. So we have committee of nurses, public health nurses, general nurses, enrolled nurses that are already in the system. These are people who have been tried and tested over the years, but we still need to give them orientation before the process goes on. We have what they call community-based surveillance volunteers. So each community in the country has a volunteer that supports when we are doing the vaccination exercise. And these people are going to be brought on board. They are going to mobilize us to ensure that there's sanity in the area of COVID protocols. So clearly, we are not going to create some new people in the country. These are people that have been used, and we are going to make sure they are being used. But let me be clear. In terms of the private sector, you can see that they have a more structured system. So we're going to work with them in their setup clinics, their setup infirmaries, so that things are going to be well organized. And I think that suits okay.
All right. Dr. Soji Tete, from where you sit, those of you who interact with the patients, on a regular or daily basis, and from the perspective of the Center for Social Justice, what do you make of the assurance and the plan going forward?
Thank you very much, Samson, for having me on your esteemed platform. I think it's very reassuring to hear some of the details of the plan as alluded to. You would notice that up until this week, there was very little information, and the Center for Social Justice was very privileged to partner the Ghana Health Service to organize a forum where a lot of details, were put out there. And I think that as we go forward, the key thing will be about information sharing. It is very, very important because you recognize that there's a technical working group that has been put together by the Director General of the Ghana Health Service with 6 subcommittees, one of which is focused on communication. And yet there's such a serious shortage of information out there about the details of the government as far as vaccination is concerned. So I would think that we would need to package the information again and put it out there. It's refreshing again to know that they are beginning to meet with organizations like the Ghana Medical Association and other health worker groups. Because if they do not have adequate information to be able to address the questions that emerge from the population, certainly people will not have sufficient confidence to tackle the matter of vaccine hesitancy, which you alluded to. The second thing that I would like to acknowledge as far as this is concerned is that this is not just a plan, but it is a costed plan. So we got to know from Dr. Kwame Amponsa Achiano, also deeply embedded within the National Immunization Technical Advisory Group, that this plan is costed at $51 million. And government is positioning itself to mobilize resources, to roll it out. Often you would hear grand plans that have no cost and no sense of what it would take to actually execute. So I think this is really good. I had some concerns when in the course of the vetting of the Honorable Health Minister and in the aftermath of the reporting that emerged, 355,000 doses was mentioned. And that clearly was way below the 70 to 80% coverage that we would be expecting. And perhaps it was erroneous reporting, but today it's very reassuring to hear from Dr. Siedu Bekwin and the Ghana Health Service that indeed the President's vision is for full coverage so that all groups of people will be able to access it to the extent that their conditions permit. Often when we start these vaccination programs, there may be some reactions and there would need to be an infrastructure in place for rapid reporting on symptomatology and how these would be contained. Again, within the plan, it was observed that the Food and Drugs Authority is fully on board and they have a mechanism in place to be able to harvest some of these symptoms and adverse reactions and to address them. So that is also a source of good observation. The last point, though, that I would point out has to do with what I'm thinking of as the South African situation. And if you look at the cold chain infrastructure in terms of what we have in place and the type of vaccines that we would be able to access, the AstraZeneca vaccine clearly comes out on top as the one that we are most prepared to roll out, again, because of that cold chain infrastructure. And we know in places like South Africa that in terms of effectiveness against the new variants that we are seeing, in South Africa, the variant is N501Y. They don't really want us to refer to it as a South African variant. But in terms of effectiveness of the vaccine against that variant, some reports put it at just about 10%. So South Africa had a similar ambitious plan to be rolled out, procure the vaccines, and are now in some sort of a limbo because there is no certainty that the vaccines will be able to tackle the new variants that are emerging. So granted that Ghana has not recorded that huge proportion of the new variant in the population, but the Director General has pointed out that they are picking some of those variants at the airport. What I would like to advise is that we need to strengthen the genomic sequencing and get a sense of the true prevalence rates of these new variants within the Ghanaian population, so that we do not go procuring only to find out that it will not be as effective as we would have liked. But other than that, I think it was a very comprehensive plan, and I would encourage the National Immunization Technical Advisory Group to do more of the public engagement, to put out more information, to mobilize civil society, the health professionals, to be sure that credible information is being put out there so that when the time comes to roll out, because this is only a few weeks away now, everybody is going to be on board to support it, to be able to get herd immunity. Herd immunity refers to a population level immunity, because if we cover enough of the people, then the small percentage of the population that is not covered will be protected as well. So that is really what we are gunning for. Thank you.
So now let's come to the very critical question of vaccine hesitancy. But before that, Dr. Mercy AHUN, having listened to Dr. Franklin Bequin and Soji Tete and Yao, is there something else that you want to draw attention to?
Well, I'd like to say that this is a rapidly evolving situation. So I'm aware that a new trial is going to start targeting children as young as 6 years. And there is also a portfolio of vaccines. So it's not only the AstraZeneca. So as the situation develops, we are more likely to have vaccines for younger people. And then on the issue of the South African variant, I think we need to be clear that that study which was done, it was a small sample size, number one. And South Africa wants to do the study. What they said was, it was the impact in mild to moderate disease. It did not seem to have a good impact. So they are going to do another study looking at severe disease and hospitalization. So this is all, everything is in motion. And as we go on, we'll pick up and we'll learn, and then we'll look at what needs to be done. Right. So it's not that we cannot use the AstraZeneca vaccine. We are still in the process of getting more information to improve the program that we are doing.
Right.
And on vaccine hesitancy, I talked about negative stories.
Right.
Sorry.
I was going to premise that question on the fact that we clearly are aware 2 million lives already globally gone. There's been a steep rise in Ghana, so we don't have an option. But with the experience, 30 years of experience that you have had, working to eliminate measles, vaccination, great work in the area of tetanus and polio, all of these, there were these rumors and stories, scares. Using that experience, how can you assist us this morning on COVID vaccines?
Yeah, trust is very important in immunization. And as I said, the success of the immunization program in Ghana has been based on public trust. So it's very important that we use data to guide the development of communication messages. So the Africa CDC, for example, has done a continent-wide study to look at acceptability of COVID vaccine, and this is going to be used. And I also belong to the WAHO Task Force on COVID vaccines, and that group is also advising countries that each country needs to have its own research to understand the beliefs, attitudes, and acceptability to the COVID vaccine so that we can develop communication, the right communication, using the right strategies to address this issue. I'm aware that in Ghana, they have started KABP, what we call KABP studies, knowledge, attitude, beliefs, practices study. The WAHO Task Force also encourages countries to use the lessons learned from the malaria study. And Ghana has a good example of doing studies, ongoing studies, longitudinal studies, ethnographic studies to understand and pick up rumors which are coming so that we are able to develop right communication strategies for that. And so that's why I say that this is all part of the package of business unusual, that we need to ensure that we are not just using the old methods, but using research and the findings from the research to direct the messages that we develop. And social media is going to be a very important part of that. At the global level, it's also very important that we continue to emphasize the technologies which have been used to create trust and assure of safe and effective vaccines. And at this point, for example, I would like to mention the vaccine vial monitor, which is a label that measures the exposure to temperature of the vaccine. In countries like Ghana, where the ambient temperatures are hot, it's very important that when a nurse takes a vaccine vial, she's assured that this vaccine is potent. So the country will continue to work with partners to make sure that this label, which is currently on all vaccines before we started the COVID vaccine introduction, is added to the vaccines so that we are sure that each vial that we use is potent and is going to contribute to protecting the people that we are going to vaccinate.
We can't thank you enough, Dr. Mercy AHUN, for making time to join us and to share this knowledge and educate people. Dr. Mercy AHUN is immunization expert and former managing director of country programs, Global Vaccine Alliance, Gavi, based in Geneva in Switzerland. A word of advice perhaps from you to all of us as to how we should stay safe.
It's important that as we wait for the vaccines, that we respect the protocols. When I arrived in Ghana, I could see that a lot of people, even at the airport, were not using masks. But from the studies that the Ghana Health Service is doing, we can see that the use of masks is increasing. Washing of hands, social distancing, all these things are important. So the vaccines is not the only solution. It's a part of the strategies that we are going to use. So please, let us continue to respect the protocol. And then when the vaccines arrive, I know there have been a lot of conspiracy theories, but we in the health sector, our role is to work with you to understand your concerns and then use the information available to show that we are to be trusted and we are going to use science and data to drive the decisions that we are making. Thank you very much.
Thank you very much. Thank you. Dr. Yao BEDIAKO, now when we hear 16 years and below are not inclusive, pregnant women are excluded. We even heard that people with, is it comorbidity or something, there may be a way of selecting and not, administering to all the aged. Don't you think all of this feed into the vaccine hesitancy? And what other challenges do you see and how do we resolve them?
I think they demonstrate that people are trying to use data to guide the process. So actually, I think that should be a sign that, as Dr. AHUN said, that data is being used to guide the process. The reason that children are currently not included is they haven't done trials yet, including children. As she said, a trial, I think even the UK is starting now, trying to look at the vaccine in children as low as, I think, 5 or 6. When you have an emergency situation like this, you also have to recognize that vaccine stocks are also limiting. And so the strategy, as is even being described for Ghana, is to initially target those who are deemed to be most at risk of severe disease. That is elderly people, people with underlying conditions. All the data appears to suggest that even though children do become infected and they can become infected, the disease appears to be less severe in a large number of children. Actually, they make up a smaller proportion of cases. So if you have limited stock, it makes sense that you initially prioritize those most at risk. And then as you vaccinate more and more in the population, you begin to shift it to cover other people. So I would actually say the fact that we are not yet approving the vaccine for specific groups of people because there isn't yet data supporting it should give people the confidence that even though it's an emergency situation, we're not rushing out to use something that is untested. The WHO, health agencies in many, many countries, including ours, are being guided by available data. And if there isn't yet data, they are patiently waiting for that data. So I actually think, there's always conspiracy theories. Recently I've told people, when you hear somebody on a YouTube video or on Facebook wearing a white coat, saying they're a doctor and presenting certain claims, do the due diligence on those people. On this show, you've got 3 of us who say, 4 of us actually, with doctor in front of our name. You can Google each of us, you can search for what we've done, and you can vouch for our credentials and decide whether BEDIAKO is somebody worth listening to. Do the same for the people who you see in these videos claiming different things about vaccines. Oftentimes you will find, I believe, that they belong to particular groups that are known for this kind of rhetoric. So I think we have to be, in this age of fake news, we each have to do a little bit more due diligence. We cannot just believe something when we see it on TV. We cannot just believe somebody when they look gray-haired or wearing a white coat and sound intelligent. A lot of the time, unfortunately, the people who make the most noise are actually the people we should pay least attention to. So, someone like, you can look at people's records. Now, we are all online somehow. So look, especially with science, if people are credible, they publish. You can look very easily to see what kind of work they've done, and you can decide for yourself whether this is something I should believe. But I also believe that that is probably easy for certain segments of our population. For other segments of our population, it may be harder to pick up a phone and Google somebody. And I think that is where we as professionals, the Ghana Health Service, Gavi, and others involved in vaccines need to recognize that we can talk all the lingo that we want, but if it is not in a language or in a way that ordinary people who perhaps don't have the same background can understand, we are missing a large chunk of people. So it's very great to hear that there is a plan to try to understand why people are hesitant. I have spoken to several of my high school friends. People call me all the time, "Oh, this vaccine, I'm worried about it." And then I try to break down, I hear what they are saying. I say, why are you hesitant? What is the issue? And then I try to explain using, as Dr. AHUN said, using data and my experience to try to debunk some of the fears. And most of the time, I think we reach a situation where people say, okay, that makes sense. Thank you for explaining it. So I think we shouldn't dismiss people's fears. We should instead try to meet them where they are and use science and data to gently unpack many of these things. Right. But I would state again, for ordinary people, when you see something, whatever it is, in fact, it's not just in the area of vaccines, but when you see something and people are making certain claims, try as much as you can to validate the source of that information before you take it as fact. Right.
Dr. Seydou Beking, I will come to you shortly, but Dr. Soji Tete, we have heard, some of your colleagues in the health front and other experts. We have heard last week I hosted the Ghana Standards Authority boss, and he had very interesting, views to share as well, Professor Dodu. Now, how do we go about this education? It certainly cannot be limited to the health infrastructure. Kofi Amekuji, for example, sends me a message from Geneva. He says that the communication on vaccine hesitance must go beyond the health infrastructure. Our faith-based groups, and Dr. Mani Buama was hammering on this in the course of the week, traditional leaders, etc., all must have an essential role in this holistic effort. Our response must go beyond the health sector. It must be inclusive.
Absolutely. Absolutely. You couldn't have said it any better, which is why I emphasized the point about communication in my first submission. A lot of the time, we like to assume that the anti-vaccine conspiracy is being spewed by fringe elements. But if you do a careful analysis, you would see that there are regular people like us who have genuine questions and doubts about whether we are going to be successful in the rollout or not, or whether it is actually safe for them to take. I have friends, non-medics, who think that the vaccine was produced too quickly, and so they are not sure they should take it. And yet the facts as put out by WHO and other organizations would show that enough studies have been conducted on the safety of these vaccines for them to be rolled out. So for me, I think that the first step is to recognize that there are legitimate questions out there, which is why I would say education, education, education. Let's communicate in simple language that people can understand.
Yeah, and that the vaccines have been produced too quickly is a fact. But it doesn't take away the fact also that they have been thoroughly researched and approved.
Absolutely.
Great.
And gone through the necessary safety protocols to grant us the assurance that you can take it safely. And that is why, for now, for some of them, we would say that you cannot administer to children below a certain age group or to pregnant women pending additional safety tests. And that should give confidence.
Right.
We have a National Commission for Civic Education, for example. It's good that they are set up to educate on civic rights and so on and so forth, but this is an emergency. And the good thing is that they have an infrastructure that goes from national, subnational, district, community levels. That infrastructure should be taken advantage of. We have a district health system. We have district health management teams with community health officers. In fact, Ghana is famous for the CHIPS concept, where we have health centers that are embedded within communities. This is really the time to package information in chewable chunks for these people at various levels of the community to engage in a constructive way. We have opinion leaders. I will not rehash those you have mentioned. So there's just a whole lot that can be done to address some of these things. The last point that I would make is something very interesting that I heard from Professor Fred Benka, a renowned epidemiologist, in his initial work in Navrongo. And he talked about the fact that actually, the principle around how vaccines work is actually known to our people, and that a long time ago in Navrongo, it was known that when children had measles or there was an outbreak of measles in the community, the safest way to protect your own children was to give them a coin to go and visit the household with a child suffering measles. And traditionally, they knew that you would pick up a little bit of exposure and build up your own antibodies to be able to fight subsequent, actual infections. So the principle is there, and we have enough information, but we cannot succeed if information around the vaccine and Ghana's plan is treated as some sort of a state secret. Under those circumstances, people will have no option than to conjure things and to listen to conspiracy theories. So I would say that the more forthcoming we should be about information, the better. And there's a communication subcommittee, and I think that this is the time to engage. The Center for Social Justice is a civil society organization. We are fighting for equity and equal opportunities for all of the population. We have used our platform, and we intend to continue to use the platform to dispel these myths so that the program of the government will succeed as far as the vaccine rollout is concerned. And I think that we should look for civil society groups and like-minded individuals, people in places of authority and influence, to send credible information across. And I think by that, so doing, we'll be able to succeed.
Right. Now, Dr. Seydou, before I get you on a substantive question, which is a concern for some people, many people really, because when this whole thing started and government was delivering PPEs, there was news, and some people were actually found to be diverting the PPEs for their personal benefit. They were profiteering from it. So we will need to address that, how you're going to be able to do that in the situation? What are the check mechanisms that you have put in place? But Dr. AHUN mentioned something which I think is very critical for the rollout. She spoke about the VVMs, the vaccine vial monitor. The World Health Organization says the vaccine vial monitors are small stickers that adhere to vaccine vials and change color as the vaccine is exposed to heat, letting health workers know whether the vaccine can be safely used for immunization. We are told that in the past, heat-damaged vaccines were sometimes unknowingly delivered, or good vaccines were thrown out because healthcare workers feared they had gone bad. But using the VVMs, we will help in this situation. Quality control. How much of, a focus do you have on that? Hello, Dr. Franklin Asiedu-Bekweng.
Thank you very much. So let me say that all vaccines in Ghana being used has that sticker, because basically it assures the potency of the vaccine, and it's actually graded.
All right.
Stage 1, stage 2, stage 3, stage 4.
Okay.
So if it's bad, it can never be used in Ghana. So it's not a new thing that we are going to introduce. All vaccines in Ghana have those stickers.
Okay.
So Ghanaians should be rest assured that our cold chain system is intact. So when there's a break in the cold chain, the color change will indicate that these vaccines are not potent and they will not be used.
How do you intend to mitigate volunteers who may want to profiteer from the program?
I think that it will be very difficult to profit from this program. Clearly, the volunteers that are part of the process, they are well-known people in the communities, and we have used them over the period of time. Let me also stress that.
Doc, we had health workers who were diverting PPEs brought in by the government for use.
Okay, so apparently there's an accountability component of the whole response. So you are assigned a certain number of vaccines, and you are supposed to account for them. So in terms of vaccine rollout, we start from the lower level. There's a community, you can be sub-district, to a district, to a region, to national. So every level you need to account for vaccines. You cannot just tell us that 20 vaccines you are bringing, reporting on 18. No. And there's a vaccine wastage rate which is incorporated into the whole setup. But I think that I need to put on record that we have a national communication strategy. And there are 3 key components of it. So there's the NCC, which Dr. Sugi talked about, the ICD, or the Ministry of Operation, and then you have the Ghana Health Service, who normally are the technical inputs into the messaging. So these structures or these entities are to permeate the local or the average Ghanaian so that they actually understand. And what they've done is that there are messages that have been interpreted into various local languages that will be sent across. Currently now, as I speak, a number of prominent chiefs and politicians and Ghanaians, even celebrities, have gotten some recorded messages, all to get people to buy into the vaccine. From next week, there's going to be an explosive campaign rollout of the vaccine, and hopefully we'll get on board. That's why the minister started engaging the professional groups as a start, and we want to continue next week. And they involve all the key partners. The media is crucial for us. At the district and regional level, we have the communication, regional communication teams that involves all key stakeholders. So we hope to go better down so that Ghanaians buy into it.
Right. Thank you also very much. Hold on, we will get you briefly on the questioning of the antigen test at the airport, which is bringing up questions of accountability. And we need to stress at this point that the vaccines shall be free of charge. the vaccines have been paid for. No one is supposed to come to you and say you pay a dime for it. Dr. Sedi Bequin, correct?
Vaccines in Ghana are wholly free, whether it's COVID, whether it's measles, they are not paid for. They are paid for by the government, so the average Ghanaian does not pay for it. It's free.
Great. Thank you very much.